Welcome back to the NExT Appraisal Tool modules. In this module, we will be discussing question number 13. Are the measures relevant and related to the study's purpose? Including the bullet points, are the measures clearly described and related to the key terms for quantitative, or the interview guide and questions relevant if qualitative? This type of information is typically found in the methods section of an article. This module is a combination of skills learned in a few of the previous modules. If you have not yet viewed the modules for question 2, purpose of the study, question 4, key terms, or question 11, data collection tools, please pause and go back and complete them before continuing this module. If you have completed those modules, then you have heard about the author identifying the purpose of the study, defining the key terms used in the study, and the different types of tools that might be used as measures. In this question, as a reader, you are appraising if the author clearly describes the measures in a way that is easy to see how the measures relate to the purpose in the study. So for example, let's say you are reading an article where the purpose of the study is to examine differences in anxiety among nursing graduates. The intent with this appraisal question is asking if, based on the definition of anxiety, if provided, and the tool used to measure anxiety, if described, does the author's description connect back to the stated purpose of the study? This may not be something that will be written explicitly in a single sentence, but rather a reader's judgment based on the methods described. Remember, in EBP, one brings their expertise and clinical knowledge in as components of the process. The more you read and learn about the topic of interest, the easier this appraisal question will become. Don't be intimidated initially. Skills are developed with practice. Read the methods section carefully and ask if the measurement seems to fit with the purpose and links the key terms. If this is a qualitative study, ask, do the questions posed to participants seem relevant to collecting the information needed for the purpose of the study? Here is an example from a published article. Notice in the example, the authors mention the key terms of stress, anxiety, and depression. The selected instrument, the parental stressor scale, was used to capture levels of stress. The information used in this appraisal question will likely involve multiple paragraphs throughout different parts of the article. Here, we would have to go back and see what we thought the author stated was the purpose of the study. In this example, maybe the author might have said the purpose was to explore factors related to parental stress in the NICU, and thus we could see the connection between the key terms, the measure, and the purpose, and decide they are all well aligned. In forming your appraisal response, decide if you feel the author provides you enough description in the article that you can clearly see the connection between the measures and the purpose of the study. Again, this may be challenging at first, but keep practicing. Your skills will improve and you'll begin to see how the elements of purpose, key terms, and measures are related, and be able to look for how the author is making this connection. This further illustrates why each of those components are important that they be explicitly or clearly described in the article. Congratulations! You have successfully completed this module. You may return to the main menu or continue to other appraisal modules in the NExT EBP course.